Okay, thank you very much. I will call the board meeting to order for November the 9th, and we do have a quorum, so I will do an invocation. Father, we thank you for this day, oh God. We thank you for just your wisdom, your guidance as we go through our meeting. We ask that you would continue to watch over us and continue to guide us as we make decisions that would affect this county. In your name we pray. Amen. All right. May I have a motion to adopt the agenda for today?
I move to adopt the agenda.
Thank you so much, Cecilia. May I get a second?
Second, this is Mark.
All right, thank you so much, Mark. All in favor? I will read our list. Mr. Adams?
Aye.
Okay, is Dr. Daler in yet? Okay, Dr. Hagler?
Aye.
Ms. Perez?
Aye.
Dr. Pons?
Aye.
Mr. Morris?
Aye.
Mr. Spitzer?
Aye.
And myself. Thank you very much. Also, could we get a motion to accept the minutes from the October 12th and October 19th meeting? That would be the open as well as the closed sessions. These are the minutes for both of these sessions. May I get a motion to accept those minutes?
I move to accept the minutes as presented. This is Steve Morris.
Okay, thank you, Steve. And may I get a second?
I second.
Thank you so much, Cecilia. All in favor? Mr. Adams?
Aye.
Dr. Hagler?
Aye.
Ms. Perez?
Aye.
Dr. Pons?
Aye.
Mr. Morris?
Aye.
Mr. Spitzer?
Aye.
And myself. Thank you very much. We will go on and move on with the agenda. We will start with our reports, and I think Sue Yates will be up.
Yes, good evening, board members. The first report you have is your monthly financial summary report. It looks at the original budget, how we started the year, which was a little over 24 million. At the end of October, we were up to 31.7 million. And as our revenues and expenses for the year come in, right now we're projecting to be about 101,000. We do know with the increase in vaccine eligibility for children as well as boosters for adults, I anticipate that number changing between now and the time we come back in January. And as we have to give more, of course, there's more expenses, but we believe the revenues for those will offset that. So we're continuing to look at this each month. If there's no questions for the financial summary report, I will go to the snapshot report. Dr. Coyle and I met, and I hope the board is okay. We came up with a light green shade. Everyone is green. We did do light green for dental health because we wanted to make the board aware we are not in the schools yet. We were supposed to start with kindergarten screenings on Monday in Kannapolis City, so that did start, but no revenue up to this point for dental health for the school system. And I believe we're still waiting on the MOU to be signed with Cabarrus County Schools with COVID and a new superintendent. That is just still in progress.
Clarify, we have completed the kindergarten screenings in Kannapolis School District, and we started our mobile program yesterday. I'll talk about that in my report. So we have gotten underway again with those, but we're not seeing any of that revenue just yet.
Yes, yes. And the other program, clinical services, is light green. While revenues and expenses are still tracking together, there is a statewide issue with billing due to our transition to managed care for Medicaid, and we are working through those as a health department and with our partners in the state to get those resolved. Some of the problems are they're even overpaying for some of our CPT codes and underpaying for others or just denying some. So we're just working through each issue and hope to get that cleaned up as quickly as possible.
The other thing to remind you all is that while dental health and the clinical services are showing a net negative revenue to expense, right now, this does not include the cost settlement dollars for dental health or the whatever the, we won't have cost settlement with clinical services, as I understand from Sue correctly, but there will be some correction factor and we would get some additional funding. Those have not been figured in, which is why we also made them sort of light green. While they're showing in the negative because of cost settlement and cost settlement like dollars, they will likely, they're looking like they will be green later this year.
Yes. I also have for the board the variance analysis report. That compares where we are at the end of October this year to last year. I want to remind the board that almost 85 to 90% of our programs get reimbursed in the rears for the money that we spend out. So we'll get our money in November for what we spent in October. And you will see expenses are quite a bit more from last year, but we also have a great deal more funding sources, more agreement addendas, and more grants. So our budget has grown significantly over what it has been ever since I started at CHA. So we have always ran 20 to 24 million in that range, and now we're up to 31. So those are my reports that talk about October. We have submitted our annual comprehensive financial report to the state treasurer's office. It has been approved by the state treasurer, and we have sent it off to the Government Finance Officers Association for their comments and hopefully their seal of excellence on our reporting. There are 99 pages of statement of net position, balance sheet, statement of revenues and expenditures. Our comment section around the management discussion and analysis. I would encourage, if you have time, to look through it, and please shoot us an email if you have any questions or comments. This does also coincide with our audit, and we passed the audit. There were no audit findings. At the end of all of that is the letters to the board of directors, and it indicates that the financial internal controls were sufficient and they did not find any weaknesses, as well as our statements were presented fairly. So I'm always super excited to get that clean bill of health and get those reports submitted in our annual package approved by the state treasurer's office. Are there any questions at this time for these reports for finance? And like I said, please shoot me an email if you have any questions as you take time to digest and review the data.
No, but thank you very much for doing such a great job. And it just, you know, that sounds like y'all did it perfectly. So thank you so much for your hard work on that.
Well, thank the board for your support very much.
And I was going to say the same thing, Sue. Thank you. Kudos for you and your team as far as the hard work you guys did on getting that presented in the report that we got back.
Yes, I have an excellent team.
Okay.
If I can just lead off with a little bit of background and introduction then for the next couple of items with our scorecards. As you all know, as board members, CHA has been engaged in a multi-year process of adopting and implementing results-based accountability and scorecards to move towards more outcomes-oriented work. Last year, we came before you with each of our divisions, showing you our strategic plan efforts to become more outcomes oriented, more accountable, and more equitable metrics within our report cards. And so this year, we are going to be showing you the specific summary of some of the report card metrics and areas that we've identified for additional work, either improvements in the report cards or when we've identified health disparities that we have to focus on. So tonight, we're going to hear from our COVID division and our communicable disease division, and we are actively engaging in keeping these short and concise for you and just hitting the main points. So with that, I'll turn it over to Tamara for the COVID scorecard review.
Good evening. Thank you. I appreciate you all letting me come and share a few things with you this evening and having your time. So my name is Tamara Saylor, and I manage the COVID department here at the Cabarrus Health Alliance. And I'm just going to share some of our scorecard metrics over the recent time. So there are a few different things that we have been monitoring: weekly changes in case counts, case investigation, vaccine-related things, and our regional infection prevention team. And so here you're going to see some information around the weekly changes in case counts. So as most of you probably already know, we did feel a nice decrease in COVID cases over the spring and summer of 21. And then those cases really started to increase around July and continued to have some drastic inclines where we experienced a peak around mid-August of 2021. That has started to come down, and we are right now currently in more of a plateau phase. The drastic decrease that we were feeling, we are not feeling currently, but it is more of a plateau. As far as case investigation, of the cases that we considered prioritized for investigation, 75% has been our goal as a department. Prioritization can change depending on multiple things. So for a while, kiddos were our #1 prioritized group to be trying to reach. Right now, it is back to everybody since the cases have decreased. And so drastic decreases, though, in case completion, you see come in tandem with the increases in cases, which makes a lot of sense. Next slide, please. So in the world of vaccines for the COVID department, our mass clinics ended at the beginning of the summer 2021. At that point in time, we did start implementing multiple clinics within the schools for those school-aged kiddos over the summer. And then next we came to our booster clinics. And then right now we are holding our very first 5 to 11-year-old clinic downstairs. I just ran up here from that clinic where I got to hold a 5-year-old's hand as he started yelling, "Yeah, now if I get COVID, it won't be that bad." So that was really exciting. And then the other area of the department is our regional infection prevention team. And this group is really around the entire region and support our long-term care facilities that are experiencing outbreaks, and some of our behavioral congregate living facilities as well. They felt the decrease in outbreaks during the summer, just like the individual cases, and then an increase in the outbreaks as the individual cases increased as well. And then they too are kind of in a plateau phase right now. Next slide, please. And so what are we going to be working on? Our future initiatives. So as I just said, we just geared up for our first 5 to 11-year-old clinic today. We're also going to increase our capacity for education and outreach in the areas of mitigation. especially early onset mitigation efforts, and then increasing our capacity for education and outreach around those 5 to 11-year-olds pertaining to vaccine hesitancy. We know that once we get through these first couple of weeks where the early adopters really kind of rush out, then we're going to have some work for us to really reach those people who are kind of, yes, I think I want to do it, but I need a little bit more information. And then we also have some staff that are going to be starting within the next week that are going to focus on testing gaps within the community and where do we see the need for some testing, whether it's related to businesses or holiday pre-testing and things of that sort. And then, of course, our ultimate goal is to develop a plan to move towards recovery versus response. So I really appreciate your time, and I'll be happy to answer any questions if anybody has any. All right. Thank you so much.
Hey, good evening. I'm Marcus Meisenheimer. I'm the nurse manager for the Communicable Disease Department. I'm going to start off by talking about the 5 most reported communicable diseases in our county, state, and country. Chlamydia and gonorrhea consistently remain across the board in our county, state, and nation as one of the most reported diseases. Coming in the 3rd spot is hepatitis C, particularly in our county and in our state. And this is directly related to the increase of intravenous drug use. And also, it has caused a spike in hepatitis A cases, even though hepatitis A is fecal oral, but I'm going to talk a little more about that later on and how we address that. Syphilis is in the 4th spot for our county. And for the nation and North Carolina, the food-borne illnesses, Salmonella and Campi, are what's holding that spot. Salmonella comes in 5th. Can you go to the next slide? Chlamydia has been steadily rising, particularly among African Americans in our county. Mainly in residents that are younger than the age of 30, they account for about 90% of the new cases that we have. And the rates are twice as high among females than males. And the main reason for that is because females are able to get tested free of charge in the state of North Carolina, whereas men are required to pay for that service. And we are looking to address that disparity. We're trying to utilize some funds from our PrEP program where we can get reimbursed for those who receive their medication through Avita, and that's going to help us pay for males to get tested so we can work on that disparity. Next slide, please. Again, gonorrhea is higher and more prevalent among African Americans in our community. This infection is affecting about 80% of those that are 15 to 29, so it's a slightly younger demographic. And as you can see, the cases are pretty much evenly distributed between males and females. And again, everyone can get tested free of charge for gonorrhea in the state. Okay, we can go to the next slide. This is a breakdown of rates for chlamydia and gonorrhea by zip codes. 28025 and 28027 are two of our more densely populated zip code areas, which would explain why they have much higher rates than some of our smaller zip code areas. And most of these are Concord. We can go to the next slide. We had a very significant increase in hepatitis A cases this year. You see that from 2020, it went from 3 to 34 this year. And one common denominator that we found was that it was among IV drug users that were presenting with hepatitis A, even though it's more of a fecal oral infection. But we addressed that by putting a nurse down in the syringe exchange and offering hepatitis A vaccines in the syringe exchange for anyone that was willing to accept that. The number of Hep A cases spiked around May and really picked up during the summer. And around that time, we partnered with the COVID department to also offer the hepatitis A vaccine in the county jail whenever they go give COVID vaccine. And since the summer, we have seen a decrease in the reported hepatitis A cases. We only had one for October. In August and September, there were 4 cases that were reported. So we are seeing some benefits from being proactive with offering the hepatitis A vaccine. Next slide, please. This is a breakdown of the hepatitis A cases, mainly being reported among white male patients. The age group is 30 to 39 years of age. Males it's affecting males twice as much as females. And again, we are trying to be proactive and offer vaccine at every chance that we can. Are there any questions? Okay, well, thank you.
We've also included here the past 5 years of all of the reportable diseases for Cabarrus County so that you can scan down through and see all of the reportable diseases and what our numbers are. And what we chose to highlight today was those diseases that we're seeing the largest number of, which this year, as you can see, is runaway first place COVID. So
I did have one question, Bonnie,
yeah.
if you could pull back. Yeah. As I look at this, it's largely, this is an overgeneralization, obviously, but these are diseases, or the bulk of them and the most heavily reported are those that typically affect younger folks. Is that a fair statement?
Right. The most commonly reported ones are STIs, sexually transmitted infections. And yes, they do tend to afflict our younger populations.
I don't know if this question makes any sense or not, but I'm kind of wondering what if you deleted out the younger folks, and looked at our older populations, perhaps in a couple of different age groupings. And I guess I'm most interested in, and the thought that's rolling around in my head is, are we doing a good job in our homes for elderly folks who are staying in, who are committed to these facilities, and are we seeing anything in those facilities? The reason I'm asking is I have a friend that works in one, and her sort of self-reporting is that she wonders if enough attention is being paid to them. So I just put that out there. Not that I have a clue whether there's anything to it or anything of importance, but I thought I'd put it out there.
Yeah, I guess a couple of comments there. If hepatitis C is certainly one that we see in older populations. One of the things I think is a real advantage for us is our that you heard from Tamara, was our regional prevention teams for COVID. We are covering the region here with teams that go into long-term care facilities. And while we are attempting to keep COVID infections lower, we're also educating them on infection control in general. So I believe that those efforts will really help keep preventable infections from spreading amongst that population. But again, you can see that overwhelmingly, the infectious diseases that we need to be most concerned about are, one, COVID, and then when we put that aside, then STDs and hepatitis C, and we are actively working with those programs to incorporate community health worker models and that, so that we can try to turn the upward trend you're seeing in some of those into a downward trend, which is where we want to go.
Hey, Bonnie, Dan, can we, and this you don't have to do this today, but convert those cases to rates per thousand or whatever is the standard tracking, so we know, is it an increase, is it a drop, depending on
the population.
Yeah.
So the slides on the STDs were rates, Dan, but you would like these all to be converted to rates too?
Well, I just need to have some idea, I guess, are
Right.
things getting worse, or is it consistent with the population? There's clearly a change since 2016, but the last 3 years you could say, well, it's kind of flat. Are we actually getting a little better? The gonorrhea case numbers are going the wrong direction.
Yeah.
And then I just sort of, it's a young population. I mean, the world's different with social media and behaviors. I mean, do we have a barrier protection message out there? We may not influence the rates of behavior, but we can emphasize you can prevent these.
Yeah, that's what I'm hoping we can now, now that we've broken down the data, that we're looking at it by, looking for disparities, and that we can start to say, okay, where do we need to focus our efforts, and how do we have to change our programs so that we start taking these in the right direction? So again, the chart demographics were rates. These are just numbers. So we can work on trying to do that to show you, are we, are these numbers just going up because the population's going up, or are they actually trending up?
And again, I think that whole place is getting this honed down to the population at risk.
Yeah.
And again, I don't know what, it's hard to get the hepatitis A population at risk to behave. We already know that, but at least you're meeting them where they're at, and you're giving them another immunization along with their COVID that they need, which I think that makes perfect sense. And it looks like, whether it died out on its own or we prevented it, because it wasn't just this county that had that problem. So
no, it was.
So I think that, that's a sort of a good story, but that, I don't want to say almost double, but that GC rate has, it could be a 1-year jump, but it's steadily going up every year.
Yeah.
But that's one you just worry about with young women and their long-term fertility. You want to prevent.
Absolutely. Thanks, Dan.
Okay. All right, we're ready to move to the regional funding opportunities.
You heard from Sue just a little bit ago that when we started this year, our projected budget was around 24 million, but it is already now, we've brought you revisions and have a few more tonight where increasing it to 31 million. And that's a significant increase. And as you can imagine, that is largely due to federal dollars coming down to address COVID. So wanted to just share these two funding opportunities that we have received since we originally approved our budget at the 24 million that has partially contributed to the increase. Both of these funding opportunities, North Carolina is really looking at a more regional process or model for public health departments and are asking more and more efforts to focus on, instead of just working within one county, working across multiple counties. And so we have agreed to be the fiscal agent and the lead county for these two regional opportunities. And the one on the left, the ARPA COVID-19 public health regional workforce, is going to bring in an additional $3 million for us this year as we look to strengthen COVID efforts across our area. We also got an ELC grant for COVID to essentially address our school district, which was also several million. The exact amount, Erin, I think it was 3 or 4 million again.
4.4 million.
4.4 million. So you can see just between that 4 million and then this grant, that's a significant increase in funding coming down to us because of the current state. And then this is a much smaller grant, the Hep C grant, but the state has recognized the need with hepatitis C cases climbing in our state to get what they're calling a bridge counselor. It views to me as a care coordinator, a care manager, to look at our hepatitis C cases and manage them and assure that they are getting connected to appropriate treatment so they do not proceed on to liver failure or worse. So we will also be serving that opportunity. So those are two examples of some regional dollars coming down that will, in the one case, be bumping our budget up rather significantly again.
Bonnie, just a quick question. The 3.2, is that for all 11 counties, or is that Cabarrus's portion of?
All 11.
Okay,
so
so
it's 3 million across the 11 county region. Yeah.
So on average, 300,000+.
Yeah.
Thank you.
You can go ahead and advance. Okay, just to provide you some updates from this past month. I really want to give kudos and a shout out to our support departments here, human resources, finance, and IT, as these larger grants that are coming down have required us to onboard a lot of additional employees and bill a whole lot more COVID vaccines and other services, and then onboard with IT services. And so our support divisions have really been working hard and just rising to the occasion to keep us working efficiently as an agency as we are responding to this unprecedented amount of additional funding that we are receiving within the public health realm. So couldn't be doing it without them, and just really want you to know how much they have really stepped up to the occasion, as the whole agency really has. For our clinical services, as I just briefly mentioned before, in dental, we've been on a hiatus with our mobile health program out in the schools because of COVID. And I am very excited to say that we did get back up and running in Kannapolis. We did the kindergarten screenings there and actually took the mobile equipment out for our first day yesterday. So we are starting to get back out in the community, where I think it's so important that we spend significant amounts of time to reach those people who just aren't able to access our on-site services. So, and we are hopeful to get Cabarrus County schools up and running shortly, also getting the services back in for them. This seems to be the time of year for audits. Our Women's Health Department had a very comprehensive audit by the state's Department of Health and Human Services, and they did very well on that audit with only very minor findings, no major issues there. In school health, as I mentioned, it's been a very busy month, both because of the surging cases, but now starting to come down, and then also onboarding a number of staff to help our school nurses with all the additional work that COVID has brought to our school health teams. And just seeing such teammanship from the whole group working together and in partnership with the school district to assure that we are protecting our children as much as possible. And so we now have we have all of our additional support staff onboarded and at the schools, so that we can be providing that additional support that the school nurses need in order to not only do normal school nursing activities, but also respond to the significant demands of the COVID pandemic has brought. For the COVID response, we heard from Tamara tonight, and I'll just emphasize that we have come through another surge. Our numbers have really come down over the past few weeks, but they have started to plateau and even eke up ever so slightly. So we're being very cautiously optimistic that we're going to have hopefully a prolonged reduction in the number of cases, but we are a little bit concerned by that little uptick we're seeing in both our percent positivity and cases are sort of leveling out. The state has shared with us recently in some of their meetings that clearly there appears to be almost a every 3 months cyclic surge. So they are cautiously watching some of the variants that have emerged in Europe and again, being optimistic that we're going to continue to keep cases under control, but keeping an eye on that we might unfortunately be experiencing a surge as we come out of the holidays. Environmental health, some of you, if you've been going out to eat at all, now that the COVID cases are dropping, you may have noticed that some restaurants have signs up saying that they don't have enough staff. And so they're either closing some days or they're having long delays in providing you service. And our environmental staff have been running into difficulties getting inspections done in an efficient manner because of the lack of staff at some of these places to work with them as they move through the process. Our work with Healthy Cabarrus is very strong right now. The housing subcommittee and the mental health committee have done some work over the past month or two and are moving forward with very strong strategic plans. We are also working with the county and others to see there will also be an opioid settlement funds being made available over the next few months, we hope. And we are hoping to be able to build even stronger substance use programs with some of the dollars that may come down from that. As we showed you tonight, we're starting to really look at our scorecards in all of our areas. We're going to, in our subcommittee of the board, we're going to be looking at the current report cards and seeing what tweaking we need to do there as we continue to move towards, again, our outcomes-based assessments. For the Board of Health activities, we approved the employee appreciation bonus, which will be going out in December for the staff for the very, very challenging year they have worked this past year. And we will also be forming a committee for reviewing some of the applications for board member recruitment. As I shared with you last week, Mr. Mack has submitted his resignation letter from the board in order to pursue his church-related activities. And first and foremost, I want to say thank you so much to Mr. Mack for his years and years of very dedicated service, and wish him well as he moves on. He has graciously offered to stay through January so that we can get a more seamless transition for his replacement. And we'll talk about that a little bit later under announcements. And then lastly, I just wanted to say that at the national level, the Build Back Better Act, which I do believe got approved over the weekend, has significant funding in there for public health, infrastructure improvement. And if the money stays in the final version, I haven't had a chance to look at just how much stayed, that will provide additional funding down to the local level for improving our infrastructure. So I'm hopeful that that will really allow us to become even stronger with that funding. So that's my report. Are there any questions?
Okay. If there are no questions, then we will move to the consent agenda, and that will be Sue.
Yes, you have the 8 budget revisions in front of you that will increase our budget by $500,000. For these funding streams, I did want to point out 2 things. One is we did finally get some money from FEMA, and we submitted that over a year ago at the beginning of the pandemic for some of our original costs, and it finally came in. I had given up hope on that, actually. And we also have a budget revision for a little over $400,000 for a behavioral health grant that is through the county American Rescue Plan funds that we will be receiving. We just received a duly signed contract today, but we knew that grant was ready to get up and rolling the minute we got the contract signed, and so we have things in place for an exciting new kind of opportunity for us to move forward. And so if there are no questions.
So Bonnie or Sue or whomever, could you amplify a little bit on the behavioral health grant and what the purposes that will be served by it, what you have in mind for it?
Yes, so this grant will allow us to hire up to 4 licensed clinical social workers to provide counseling services to residents in the county who have developed significant additional problems with mental health, oftentimes related to the isolation and other stressors of COVID, like unemployment and things like that. And so Sonia Bahona-Thacker will be leading that effort and building a behavioral health unit here in the department to begin to provide counseling with a special focus on folks who are uninsured or do not have, otherwise don't have access to mental health counseling services. As some of the additional opioid settlement dollars become available, we are also hoping to build an even more robust focus on behavioral health services through enhancing our substance use services. So we're very excited about this because, as you know, mental health is one of the top 3 priorities in our county that identified by our community health needs assessment. And we have been talking at the leadership level about the need to evolve a more strategic approach to behavioral health issues for our county, and these grant dollars are going to give us that opportunity. So we're very excited to move forward with that effort.
Yeah, that's great, and I hope you'll keep us informed of how that proceeds. It is such a enormous problem.
Okay. All right, any other questions on the consent agenda? If not, may I have a motion to approve the consent agenda?
Dan, so moved.
Okay, and that was,
Dan on the first and Mark on the second, I think.
okay, thank you very much. All in favor, Mr. Adams,
Aye.
Dr. Hagler,
Aye.
Ms. Perez,
Aye.
Dr. Pons,
Aye.
Mr. Morris, Mr. Spitzer,
Aye.
and myself. Aye. Thank you very much. Motion carried. Okay, we will move to the business agenda. And again, Sue, you're up again.
Yes, the first thing on the business agenda is the county funds that we receive from the American Rescue, or they receive from the American Rescue Plan funds. We are so graciously excited and really appreciate the county's confidence in us to help continue to grow in the county. Below are the items that we submitted to the county to help us continue to move forward in our public health efforts. These funds do have lots of reporting restrictions, a whole set of parameters around the funds, and one of the parameters is the funds need to be accepted by our board. So we will bring you other budget revisions throughout the year as we nail down a little bit more about each one of these so that you can approve it and we will spend it. The behavioral health program, I went ahead, it is a multi-year project. So this has what the total contribution from the county will be for this program, and the budget revision had what we believe will be spent this fiscal year. So that is the difference. It's 4.8 million, almost 5 million that the county has contributed to CHA through these funds, and we are very appreciative.
Okay. Any questions? Okay, so we need a motion to accept the funding. And may I have a motion?
I move to accept the funding.
Thank you, Ms. Perez. And may I have a second?
Second.
Second.
Thank you, Mark. Okay, all in favor, Mr. Adams,
Aye.
Dr. Hagler,
Aye.
Ms. Perez,
Aye.
Dr. Pons,
Aye.
Mr. Morris, Mr. Spitzer, and
Aye.
myself. Thank you very much. Motion carried. Okay, and again, Sue, you may continue.
Okay, there are 3 policies. These 3 policies have changes. Dr. Coyle mentioned the women's health audit, and in the women's health audit, they also go through finances and our finance policies. The changes are minor. It has to do with sliding scale fee for family planning patients, as well as the documented levels for the federal poverty levels. So they are minor little changes in here. And I would say the biggest change would be that family planning patients, if we have exhausted all research to get documented income, that we need to accept patient reported income. So does the board have any questions about these policies?
Okay. Okay, with there being no questions, may I get a motion to accept the finance policies as they have been presented with the updates?
I move to approve, Mr. Chairman. Steve.
Thank you. Thank you very much, Steve. And may I get a second?
Second.
Thank you very much, Mr. Adams. All in favor, Mr. Adams?
Aye.
Dr. Hagler?
Aye.
Ms. Perez?
Aye.
Dr. Pons? Mr. Morris,
Aye.
Mr. Spitzer,
Aye.
myself, aye. Dr. Pons? Okay, we'll move forward, and our next item will be, again, you, Ms. Yates.
Yes, it's my last one for the evening. The laws of the state of North Carolina can be slightly antiquated, but they have changed to where the board can accept the use of electronic advertisement for our RFPs and for our bids versus them needing to be listed in the newspaper. But to have that change, our board has to accept that you approve of us using electronic advertisement. It can be Facebook, Twitter, all the social media platforms versus the printed newspaper that is delivered to your home or that you pick up at a newsstand. So that is the purpose of this resolution, that you agree that would be acceptable for this organization.
Okay. Any questions on the resolution? Okay, if not, may I have a motion to accept the resolution?
I move to accept the resolution.
Thank you, Ms. Perez. May I have a second?
Second, Dan.
Thank you very much, Dr. Hagler. Are all in favor? Mr. Adams?
Aye.
Dr. Hagler?
Aye.
Ms. Perez?
Aye.
Dr. Pons? Steve Morris?
Aye.
Mr. Spitzer? and myself. Thank you very much. Motion carried. Okay. Our next agenda item will be informal comments, and normally we would open up the floor for informal comments and from the public, which again, I don't know if that will be any here, so I'll give it the floor is open. If there are no comments, we will basically close the floor and we will move to our announcements. And Dr. Coyle, you are up.
Yes, so just a couple of things to talk about with the board membership. First is last month, I reported to all of you that Chris Bowe has accepted a different position within the Atrium Health System, and so he had to step away from being a board member. Asha Rodriguez, who is the current CEO of Atrium Cabarrus, has expressed interest. She has submitted her application. And the committee of Mr. Mack and Dr. Pons and I sat down earlier today and reviewed that. And the committee would like to recommend that the full board approve Ms. Rodriguez as Chris Bowe's replacement, which requires a health care administrator on our board.
And the references and the information that we have received, Dr. Pons, as well as some of the other individuals that are on her application, I know them very well. And again, I think Mark Spitzer has also given a very high recommendation as far as him knowing her. So I wanted to ask the board at this point in time, could we have a motion to go on and accept her application? And if we can get that motion to carry, then again, we will go on and forward that over to the county commissioners. So may I have a motion, or are there any questions, I guess, first before I present the motion? Okay. So may I have a motion to accept Ms. Asha Rodriguez as a nomination that we can submit to the county commissioners?
I move to accept.
Okay, may I get a second?
Second.
I second.
Okay, so that was Ms. Perez and Mark came in first as far as a second. All in favor, Mr. Adams,
Aye.
Dr. Hagler,
Aye.
Ms. Perez,
Aye.
Dr. Pons. Okay.
Aye.
Thank you. Mr. Morris,
Aye.
Mr. Spitzer,
Aye.
and myself. Thank you very much. And we can go on and get that application submitted over to the county commissioners.
Okay, Okay, thanks, everyone. And then the second issue is, as I notified you last week and just previously mentioned earlier this evening, Mr. Mack has submitted his resignation to pursue other incredibly important activities. And so we will also need to identify a replacement for Mr. Mack's position. Mr. Mack sits in a general member of the public position. And so when that role comes open, we look at the applications that have been submitted through the county process. And we just recently reviewed some of those this past summer as we brought on Cecilia to our board. And so I asked if any of you were interested in being on the committee. We usually have a committee of 2 board members and the clerk and myself. Right now our clerk role is open, so I will serve as the clerk. I did not hear back from any of you about an interest to meet with Dr. Pons and myself. I'm hoping one more of you might consider stepping up to review the applications that we have and then bring back to the full board a recommendation for a replacement for Mr. Mack's open position. Anybody interested?
I will be able to help. I will be
wonderful.
Happy, so.
Thank you.
Thank you so much. Thank you so much. I do want to say, I guess in my submitting my resignation, normally I would fulfill my term, and I was looking forward to doing that. But the opportunity to continue, there was more responsibility given to me at my church as far as what I do in my present role. And to be able to do that, I would not have the opportunity to continue to do what I do here. But I do want to say the 9.5 years that I've served on this board, I have enjoyed working here beside the management team as well as the associates. I hope I have provided a service that has been, satisfactory to the board as well as to the associates. And anything that I can do moving forward to continue to assist CHA, I am very happy to do whatever I can to appreciate that. But I do appreciate the cooperation of each of you that have been on the board for a long period of time, as well as the new members. So thank you very much for putting up with me for these years.
If I may interject, just a thank you to James Mack for what he's done for the board. Throughout my tenure on the board, he is the only chairman that I have known in that role, and so certainly wish you well. And also wanted to say to Bonnie and Dr. Pons, if I can be of assistance, or if you need somebody to fill in on that role, that selection committee, feel free to call on me as well. And thank you, James.
Thank you, Steve. Yeah, I want to echo that. Mr. Mack, I know you had already served a significant number of years, and yet your commitment to the county and to the organization at a time when COVID was just really in crisis mode really shows your character, and that you didn't want to step away last summer when you wanted to sort of see the pandemic through and some of the changes we were trying to make here. And so really appreciate the commitment that you demonstrated for all these years and making sure that you got both COVID and the organization to a good place before you stepped away. So thank you very much.
Very welcome.
The additional question that then brings up is that Mr. Mack is the chairman of the board, and so not only do we need to find an additional board member, but we will have to have a discussion about the chairman role. We were just checking the bylaws because I was not sure if so Dr. Pons is our co-chair. I wasn't sure if that meant that she automatically steps up or what the bylaws say we do in this case. And to my review, the bylaws do not clearly specify this. So there are several options we could take. We probably need to clarify our bylaws, what we do in this type situation. And then there'd be several options here of that we clarify the bylaws to say that in this case, we would ask the co-chair to serve in an interim capacity until we get to the normal annual meeting where we elect those. We could we could take nominations now. Because it is not clearly specified in the bylaws, want to take a minute or two to see what you all thought and how we would proceed in that manner. We could also have the committee that meets come back with, flesh this out a little bit more and come back with a couple of recommendations or nominations and that sort of thing. So. Mark, you look like you're
Mark.
you're highlighted, which means you're about to say something.
How did you know? So
We could usually depend on it.
I finished my dinner, so now I can talk. First of all, just to echo other comments, Mr. Mack, you've taught me a lot, both about how to be a chairman effectively and how to be an effective board member. So you'll be missed tremendously by me. I think that I like the idea of getting the committee engaged in looking at the chairmanship role and determining perhaps some recommendations that could help the full board to make a decision going forward. So that would be my thought.
Any other thoughts there?
I would agree with what Mark said, to let the committee work on that and perhaps bring some recommendations back to the full board.
Did you get the part recorded where he said he agreed with Mark?
That's a landmark event.
And Bonnie, any role that I can play through that process, I would be more than willing to. As I said, I would want to help to do everything I can to make it a smooth, seamless transition.
Thank you, James. As I said before, I'll just say it again in case you didn't hear. Mr. Mack has agreed to stay on definitely through the end of January so that we can get a transition going here. So hopefully we can get the committee together within the next couple of weeks, identify a great candidate and get that voted on, if not before, then by that January meeting, early January, so that we can try to have, he would finish out through January and then we could, it might be tight, but we could get our member on then by the February meeting.
Does the county have to approve that?
Yes. So that's what I mean by it might be tight, because it seems like if we don't approve it till January, then we miss your January meeting, Steve, where it would get approved. So, but we'll have to look at those dates and see how they line up. But so, okay.
I think the next item was a board meeting schedules.
Yeah, so I just want to real quickly, you'll notice at the bottom of your agenda, our next meeting will be January 18th. You will notice that seems a little bit later in the month. Remember, we agreed on a month or two ago that we were going to bump the meetings to the third Tuesdays of the month instead of the second Tuesday to allow more time for our financial closing out of the books to prep for the meetings effectively. We are also looking to go to having the board meetings every other month and then committee meetings in the off months. And I will get that schedule out to you within the next few weeks, along with the calendar invites for next year's meeting schedule. But just that reminder to you all, when you see those calendar meeting invites coming out for what appears to be a slightly different date in the month, it's because we had all agreed that that made sense for efficiency purposes to bump to that third Tuesday. And then that brings, any questions about that, the schedule? Then that brings us to the last item of discussion related to the December celebration. So as a new member here myself, I have not had the pleasure of enjoying one of these December celebrations due to COVID, but it is my understanding it has been a tradition in the month of December for there to be a celebration for the staff, usually a luncheon, and then the board members also attend so that we can celebrate the agency, the good work that everyone's doing, and board show appreciation to our staff, and our staff show appreciation to the board. We had to sadly cancel that last year because of a COVID surge, and was wondering everyone's thoughts on potentially doing something like that this year in a safe manner with the uncertainties that we continue to see with COVID. I will point out that we a number of months ago, before this last surge, we were able to hold a volunteer appreciation event where we had it as more of like a drop by, and in order to keep large numbers of the counts down and things like that, so that there might be ways we could try to do something where we create some amount of interaction, but also recognizing that as a public health department, we need to be cautious. So any feedback on that idea?
I think if I were asked about planning an event like that, I would say, well, let me call Bonnie and Aaron and see what they think. So
yeah.
I thought you were going to offer the gym theater for the event.
well, that certainly is something we could do, and we would be delighted to at any time.
Aaron, I know you had a couple of thoughts or ideas. Do you want to share anything about how we might be able to do this in a safe manner?
Sure. Good evening, everyone. And yeah, I can tell you that Steve is not wrong. He sends lots of referral calls our way, which we appreciate. So I would love to see us be able to do something. I think our staff need it. I just think it's time. And I think given our very high vaccination rate amongst our staff, I think we can do so in a safe manner. So we can find a facility where we can spread out and just spend some time together and a way to enjoy each other. So we have normally also done then our January Years of Service celebration. So one of the things I recommended to Dr. Coyle was perhaps we combine the two, and that way we could recognize our staff who are celebrating milestone anniversaries in front of the entire team instead of a smaller subset of staff and our board, and knock out two birds with one stone. But not a huge event, but something nice for our staff, because again, I think everyone would appreciate it, and I think our folks need it. So yeah. But we would love for you to be there. So we would work hard to get a date and time for you.
I agree. I mean, I attended the volunteer event, felt very safe. I mean, I love it. And I think that it would be really nice for our, board members and staff just to spend some time together as you determine it is safe.
Thank you.
Dan, I just make some comments. I had actually this similar exchange with Dr. Passaretti and one of our teammate health people that's responsible for, OSHA regs, and of course that's all kind of up in the air with where things are going. So again, the hospital system's being fairly conservative. To me, this has driven off prevalence in the community, and an event like this for us, again, we aren't the community. We have a, mandatory vaccine or protection policy. So, our risk is not the same as the community at large. I would just want to be sure that, people will be looking at us to set an example.
Yeah.
And if we do it and things, again, this gets in, I think, I'll just be honest with you. Katie was tempered by those sort of projections, and I'm, we haven't been very accurate in projections with this, so I have less faith in them. So, if you're projecting that we're going to have an every 3 month and, we could have another spike at about the time we do this, I would say maybe we be cautious, but I actually personally believe that there's a counter argument, especially if this becomes a chronic issue, that resilience and the teams getting together for normal social interactions is important. And if we're doing what we're supposed to do, it should be low risk. So I favor doing it, but I just think we have to be consistent, because in this area, we are setting the example.
Agreed.
I agree with Dan. If it is valuable or makes sense, certainly we could use the event room in the core lab on the first floor that many of you are familiar with. It has a fairly large size and can accommodate a lot of people. So that I offer that. But I agree. I think we should do something. I think the staff deserves the recognition, and I'd personally like the opportunity to thank them.
I'll chime in. I agree. I also believe that I think the staff deserves it. And also, what a powerful way to show the importance of vaccination. That if we do this in a safe way, everybody knows that we have 90% plus vaccinated. Yeah. What can be done in a community if we actually roll up our sleeves and do what is right.
Yeah.
And I'm in agreement with everybody else that we do show the associates just how much we appreciate them, and especially during this time of year. So.
Okay. So we'll go put our heads together and come up with some very, very safe strategies and keep you in the loop.
Okay. Any other announcements before we look to adjourn our meeting? Okay, if not, may I have a motion to adjourn our meeting?
Motion.
Thank you very much, Dr. Pons. And may I have a second?
Second, Mark.
Thank you very much, Mr. Spitz. So all in favor, Mr. Adams?
Aye.
Dr. Hagler?
Aye.
Ms. Perez?
Aye.
Dr. Pons?
Aye.
Mr. Morris?
Aye.
Mr. Spitzer?
Aye.
And myself. Thank you guys very much. And I guess we will see you at the December celebration or at the January 2022 meeting. So you guys have a great time. Have a good holidays if we don't see you before then.
We get two celebrations, the holidays and your retirement.
Yeah.
Oh, okay.
So I like that plan. Parties are always good.
Thanks,
You guys
everyone.
have a good evening.